Hi everyone, my name is Gregory. Today I would like to present a case, a simple case, the first case with Omnicam. Patient is missing number 31 and wants to restore with the Emacs crown. So you can see that by looking at the X-ray, patient doesn't have no symptoms, previous root canal, previous PFM, and we start probably choosing the Emacs material on the screen. So by choosing this again, Ivoclar in the Emacs material, we'll proceed. The next step is the scanning the upper arch while the patient getting numbed. So in this case, again, we start scanning the upper arch. You can see that's my window, how I trying to um, record the video for you guys while I'm doing scanning on the upper arch. So this Omnicam, when you initialize the scan, it will bring that kind of sound that's connecting all the data. But again, it's pay attention on the right screen and on the left screen to make sure so you feel all the data. Because we're doing the lower posterity, you don't need actually palatal area of the upper arch. So you collect the data, and when you satisfy with all the information you got from the scan, you can proceed with the buccal scan. You can see that the camera is still working, so in order to shut down you have to click on the icon of the camera, and while the computer will collecting the data, so make sure it's we have all data necessary to proceed with the case. So the next step is we choosing the buccal bite, and you can see that I made a mistake. That I'm trying to scan buccal bite without dental assistant help, and you can see I've been trying. I got some lipids on my hands on the way, so it will interfere with my buccal bite stitching. So what I did, I trashed this scan and asked my assistant to hold two mirrors to retract the checks, and I will probably I'll rescan the buccal bite again, and you will see it's on the screen right now. Again, the Omnicam is beautiful. It's give you so much data, and it's a buccal bite. It's collecting the data and it scans so fast, so it's better and visually, and it's better also. So you can see clearly that's what you the teeth and the cervical parts and the gums. So you can see it's a scan again, so to make sure to have inside the edges of upper teeth, to make sure it's my buccal bite will stitch smooth. So after we're done, it's I prep the tooth number 31, and when I'm done, it's I did a little soft tissue crown lengthening procedure on the tooth, and so this time we're trying to scan number 31. So my tip is try to scan from the anterior teeth towards the back one, so you can retract better. And you can see in this picture that when you scan the anterior teeth, it doesn't catch the data. So make sure that you go to premolar area where you have a wider surface area. So then you will proceed with anteriorly or posteriorly. So in this case, again, it's I try to start with my premolars and slowly going back, so to make sure I have all the data necessary to proceed with the case number 31. You can see the pictures are clearly, so I can see the margins clearly. You can see a little bit crown lengthening procedure on number 31 itself. So I see my margins clearly. It's again, and when I'm satisfied with all the data been taken by the scan, I'll proceed with the next step when I have to stitch my buccal bite. You can see right here that's how Omnicam fast collect the data when you scan. Again, this probably would not be necessary to probably collect the data on the distal on number 29. Again, we'll proceed with the buccal stage. Again, it's going to be very easy to stage the upper arch. Then I have a few attempts to stage the lower ones, and probably on the second attempt it will stitch together. You can see that I have enough clearance to build my crown on number 31, so a margin at the case. So, and I have to correct where my margins a little bit off from the preparation, so I have to adjust this area. And when I satisfy 100%, it's how my margination is, so I'll proceed with the case. Again, I don't need any cord packing because I clearly see a demarcation between the tooth structure and the gum. So now done, let's proceed with the case, and we'll make sure that we have defined the axis of rotation, insertion, I'm sorry, and the software will start creating the crown for us. So again, it's when the crown is going to be created by the software, you can see a little bit discrepancy on the crown itself. So I have to correct with a few tools. I'm checking also how much clearance do I have, how much probably I can play with the with my crown compared to the interocclusal clearance. So you can see here with the model box, we have no binding on the crown, and this is the final case. So you can see the margins on the buccal and the final x-ray, and this is going to be a crown from the occlusal view. Thank you very much.